Talk about periodontal disease, there's actually two different types of periodontal disease. There's gingivitis and periodontitis. Gingivitis is just an inflammation of the gum tissue, whereas periodontitis is inflammation of the gum tissue, but you're also starting to lose the support structures of the teeth, like the bone and the gum tissue might be breaking down to cause some gingival recession or something. Most of the periodontal diseases are caused by bacteria, and really it's the body's reaction to the bacteria that causes periodontal disease. It starts off with inflammation of the gums, leads to some breakdown of the bone supporting the teeth. As the bone starts to break down, we develop deeper pockets around the teeth, which is the space between the teeth and the gums. Some people may notice bleeding of the gums. They may notice bad breath as being some common symptoms associated with that, but not everyone has bleeding of the gums, bad breath. If periodontitis is allowed to continue, it actually speeds up in terms of its progression. As it speeds up and gets worse and worse, patients can lose teeth associated with that. It's very important to treat periodontal disease because obviously the progression of periodontal disease at its end stage can lead to the loss of teeth. The other thing that we want to think about though is the fact that periodontal disease has other systemic issues. Issues that can affect other parts of your body is what that means. You can have a higher incidence of heart disease associated with that. There's ample evidence of increased risk for heart attack. There's now evidence for increased risk of stroke. We know that people with diabetes have higher incidences of periodontal disease, but also people with periodontal disease have higher incidences of diabetes as well. So there's lots of different things in the body that can be affected by the condition of your mouth. 85 to 90% of the population have some degree of periodontal disease activity going on in their mouth, whether it be gingivitis or periodontitis. So we know that people with dental implants who are susceptible to periodontal disease and who have uncontrolled periodontal disease in their mouth actually have a higher incidence of having complications associated with their implants as well. There's a condition called Peri Implantitis, which is similar to periodontal disease, and Peri Implantitis results in bone loss around implants, infection around implants, and we know that there's a higher incidence of patients with Periimplantitis who have uncontrolled periodontal disease. So you want to make sure if you have dental implant treatment that you also have your periodontal condition under control.